went and looked at the other things, it turns out it wasn't. His homocysteine was 4.8. His vitamin D was 30. It should be above 50 at least. He had elevated candida. That's probably why he craved sugars and sweets a lot, because he wanted to feed all this yeast. And his plasma folic acid was greater than 24. So if you don't look at the right things, you won't find them. This was his test. That was January. Okay? So we decided to go ahead and put him on the program. Now, we don't have hyperbarics, but we put the methylated B vitamins in. Because he had yeast, we used the inflammation and infection control and backup one. Because he had these peaks and valleys, that's viral inflammation, so we also had to control that too. Go ahead. Mitochondrial restore, remember he's weak and clumsy, low muscle tone. And then we gave him some advanced neurotransmitter to help his dopamine support. We diagnosed him with labyrinthine dysfunction, coordination disorder, imbalance, dyslexia, and methylation deficiency. Not ADD. Do you understand? We treated him with these. Now it seems like a lot, but what you do is you come in and control all these things, and you back off with these, and we're left with 2 or 3. Excuse me. Go ahead. And that was him 9 months later. Not too hard to see what happened, is it? Now, is he perfect? No. That's his eyes, that's his ears, and that's his muscular system. Still a little bit separate, but it sure is a whole heck of a lot better. Okay? And the moms come in, and they're all excited because he's actually back to a reasonably normal boy. Starting to get more back with it, starting to pay attention more. The school doesn't know what happened to him. You understand? They done a lot. This little boy, which I hear a lot, went back to school in August, late August, and they didn't know what happened to him. Okay? So I wound up having 2 of the therapists from the school come over and see what we did. And you know all we did? Put the cofactors back in him. Okay? Let's do another one. 44-year-old woman previously diagnosed with fibromyalgia 3 years ago. Her pain initially started in her legs following a car accident when she broke her ankle. Okay? Remember? Trigger, injury. She had a severe migraine. She's had severe migraine headaches since she was in her early 20s. It's her worst right around her period. She has significant fatigue and some days can barely get out of bed. She's 44. Okay? She had issues with irregular menstruation, poor sleep patterns, foggy headedness, constipation, occasional dizziness. She gained 45 pounds over the last 3 years. Okay? She averages 3 antibiotics a year for sinus infections or bronchitis. She has routine chiropractic adjustments. Okay? Kind of a mess, huh? Can anybody relate to this? She's on an SSRI, antidepressant. She's on Neurontin. She's on Zolpidem to help her sleep. She's on Frova for her headaches. And she's on Topamax to try to prevent her headaches. But she can barely get out of bed. Do you understand? Her routine blood work did show a high MCV. This is the red blood cell size. Mild anemia, low normal free thrower, low progesterone. So our doctor did a pretty good workup. But if we didn't know about the other things that we know, we wouldn't have been able to alpha much more. But when we checked her homocysteine, it was 4.5. Her folic acid was greater than 24. You just better get used to this. You start seeing it in these patients, you'll be amazed. Vitamin D was 12. And she had low T cells. Now, I happen to know that I find more T cell abnormalities than any doctor in the state of Texas. Do you know how I know that? In Texas, we're so worried about AIDS that we pay a person from every county to review all the T cell abnormalities, and they have to call the doctor to make sure the patient doesn't have AIDS. Okay? And I get more calls. In fact, it's a joke now when they call, because most of them are kids. You know? Okay? But if you don't look for them, you won't find them. Now, if you got low T cells, which are the things that kill viruses and bacteria, is that a child you want to put vaccines in?
No.
Now, I am not opposed to vaccines, but what I clearly am opposed to is not knowing the immune status of the patient prior to giving the vaccine, because especially the live viruses are live viruses, okay? We don't give vaccines to AIDS patients. One, because they don't work, but two, because we don't want to introduce infectious agents into AIDS patients. Well, why are those people in Texas calling me? Because those abnormalities are so significant, right? Now the problem is, I understand it's too expensive to check every kid's T cells. But what I would like, personally, is for us to augment the schedule to push the babies and let them get a little bit older prior to us going in and being so aggressive at an early age. And especially grouping, because it's common sense to know that we can't give 5 vaccines at once, because it's not good to be sick with 5 things at once. You following me? So I want to make sure you understand my position on that. Okay? So I don't think we're ever going to win saying no vaccines for anybody. That's too big a political climate to hurt, too big a hurdle. We're also never going to win giving vaccines to everybody, because we're going to make a lot of these kids really in trouble, and that's why you're here. So what we did is we took that homocysteine marker, and I filed a patent 3.5 years ago to use that as a potential marker to tell us when people are ready to get vaccines, because if it's too low, we've got a high chance of having immune abnormalities. And if we can develop a rapid little screen for that, it'll be a lot easier for us to tell which children are ready. Right? Make sense? Well, this was her initial one. You can see these peaks and valleys. That's the inflammation in the nervous system. You can see this organization, everything's talking to her separately. Okay? Go ahead. We decided, just because of everything she had, that we'd actually use all these. And I don't always use all these, but in people who need them like this, you have to. Okay? Go ahead. So we diagnosed her with fibromyalgia, imbalance, and fatigue. Now those are not diagnoses, those are symptoms. Okay? But we actually put her on this regimen because that's what the testing told us we had to do. Do you understand? It's not because I want to, but even though we've parsed all these down, we still have to accomplish what we need to. Now once we get her healed, we can come in and take off a lot of these, and we'll be stuck with what we're left with, okay? But if you don't have a thyroid that's working, and you're having to take thyroid, what's your doctor going to do for you the rest of your life? Give you thyroid, right? Well, if you can't make methylated B vitamins, what do we have to do for you the rest of your life? Give you methylated B vitamins, okay? So she came back to see me at 12 weeks, and her pain was, better, a little bit less, but she really looked better. She just looked like she felt better. She had gross coordination and balance. It was much better. Her anxiety and fatigue and cognition was still there at 12 weeks. And she was still like, Doc, I don't know. But you'll see the test, and you'll see that we knew from the test that she was getting better. So a lot of it at 12 weeks is a pep talk. You know, look, you are getting better. You can't fake these tests. Just hang in there. We will get you there. Okay? Because I can't tell by symptoms whether you're getting better or not, and neither can any other doctor. Okay? But at 30 weeks, here she comes back in a completely different woman. Her cognition, her mood, her anxiety, and fatigue were markedly improved. She had pain intermittently, but mostly good days. Not bad. Instead of pain every day, mostly good days. She lost 15 pounds. Okay? Her husband told me he had his wife back. Gave me a huge hug and a kiss on the cheek. Okay? And she's starting to exercise because they're going to begin traveling again. Because she was housebound forever. You following me? Now here's what the testing showed us. Back up 2, 3. There's where she started. Okay? There's where she came when she came in. Now this test looks a whole lot better. See how these are nice, and the blacks and the blues are separated and they're starting to organize, and see how this has come way down? But she didn't feel that much better. Do you understand? She knew she felt a little bit better, but I didn't get her to buy in, you know what I mean? She didn't know she was getting better. So that's when the testing really tells you, because without it, you can't tell anything. Then watch what happens at 30. All blue, centered, still a little inflammation, but boy, this lady's back. Do you understand? Now when we get to there, we really don't have to test her a whole lot more. Do you understand? Now I'll guarantee you she'll come in every year to be tested. They always come back to just make a follow-up. I just want to check how I'm doing. Because they don't want to get back to where they were. Because the problem is if you don't overcome the genetics, you're just another triggering event away from getting back where you started. You following me? Okay. That's all I have to say. I'm sure there's going to be questions.